Essential oils can be a fantastic add-on for managing migraines, pain, severity, frequency, and of course medication use as well. The hardest part about it is most of the studies that have been done really well are recent years, and there aren't too many of them yet, but I'll go through some of them in a minute. The critical thing about migraines, as I've already highlighted in my big video on migraines in the gut, is that there are a number of issues that link in with migraines. So you've got oxidation, inflammation in your immune system, neurological, hormone, endocrine, metabolic, like the mitochondria, which is a really new area being researched in terms of migraines and getting the mitochondria working functionally to clear everything out. And of course, vascular, and my most important one that I emphasize in the video is already on that, all about the gut and managing migraine through the gut. So understanding that, then it comes down to some really, really simple properties. What we're after is something that's going to look at lots of those things, and that's what essential oils do. They've got multiple ingredients. Each essential oil might be a dozen or 20, 30, 40, even more. And each of these kind of work in synergy to help you out. And the one that shows up in the literature, the best in terms of the type of signs and symptoms around migraines and the studies on migraines, is without doubt lavender. And great, I love lavender. I always use lavender, it's fantastic. But it's antioxidant, anti-inflammatory, anti-hypertensive, so it helps with lowering blood pressure. So if blood pressure is an issue with you and migraines, then it's analgesic, mood stabilizers, and there are plenty of studies showing that it lowers anxiety, depression, stress, improves sleep, and pain. And in particular, I thought this one was important. They've used it with burns patients. So burns patients is a pretty severe pain. So, and it showed up again, very effective. So we've got all of these benefits of lavender. The studies, the two big studies that have been done on lavender, and as I said, unfortunately, the last couple of years, they're concentrating, and I know there's some more underway now. And there was one where they looked at a 30-minute inhalation, so some aromatherapy in the room for 30 minutes over a 3-month period. And it was looking at the rates and the frequency of migraines. And it decreased the frequency and it decreased the severity according to what is called the Midas scale. It's a measure of the severity of migraines. And it also was found to decrease cortisol level, which is linked in with migraines, linked in with your whole neurotransmitter system, and of course, stress. The second big study was one where they looked at people who had migraines, and they were looking not in this term to prevent it like the first one, but can we manage the pain with it? And in this case, there are 129 migraine attacks. So the people then went around and they literally breathed it in for about 30 minutes or so, and they found that the 92 of those 129 improved and gave it a 4 5-star rating. So a really good rating. So lavender has been shown up to be effective in all of these conditions here, and more recently in terms of preventing, help reducing the severity and symptoms of it, and of course the actual migraine attacks themselves. And one is Pepin oil. Without any doubt, Pepin oil comes up really trumps in terms of managing pain. And there are dozens of studies to do with gut pain, which of course I know about, and IBS, but all types of cramps and so on, but pain throughout the body. Pepin oil is fantastic in that. Pepin oil has also been shown to be effective in migraines. However, where its strength lies is in terms of pain. There are dozens and dozens of studies on pain management. So gut pain in particular, there are dozens of studies linking it with IBS pain, irritable bowel syndrome pain, cramps, and various others, dysphagia. So great for digestive pain, great for other pains around the body, period pains, and quite a few to do with pain and sleep. So Pepin oil comes in trumps when it comes to pain management as an essential oil. Then you've got the studies that were done specifically on migraines, and this one, well, it was on chronic headache, in fact, and it was adolescents, and they saw a decrease in pain and anxiety in about 95.5% of the participants recommended. That's all bar one, by the way, in terms of the numbers. And in the second study, pain control with migraines, they compared lidocaine and peppermint. So this is immediate management of pain, and they both showed up around about 42%. So great add-on in terms of trying to manage pain. Then we've got one with chamomile here. Chamomile, where they inhaled it for 30 minutes at an instant where there was a pain attack, and it was found to decrease pain, nausea, vomiting, photophobia and phonophobia, so bright lights and loud noises. And in another study where they looked at chamomile and lavender, and there are a couple of studies where they've added both lavender and chamomile to other combinations and cocktails too, because of their added synergistic benefits. And in this study, 33 drops for 30 nights decreased anxiety, depression, and stress. And the third one here is anise oil, and in a study on migraineurs, it decreased frequency, duration of migraine attacks. Rosemary oil shows up in heaps and heaps of studies and just about everything to do except with migraines. But when you look at the benefits of rosemary oil, a lot of people are touting, well, it's good for migraines, it's good for headaches, and it's good for lots of the symptoms. It probably is, but I couldn't find a clear study on rosemary oil. But it's anti-inflammatory, anti-anxiety, so analgesic and pain, memory. There's a lot of studies now coming out showing that it has neuroprotective effects in the brain, and one study on rats and mice which showed that it actually was able to reverse some of the plaque damage that is linked in with Alzheimer's. So it has anti-Alzheimer's, and that was literally through inhaling some rosemary. So that's a nice thought anyway, but it has these neuroprotective effects. So any damage that is caused during migraines and so on, which is inflammation, oxidation, it may be able to help that as well. But it's also decreases gut LPS. LPS is the toxic chemical that often breaks down in leaky gut and gets through and is linked with migraine. I hope you've watched the video that I've completed on the gut migraine brain axis, because the gut is a big driver for migraines, one rather either directly or indirectly, and this is one of the ones, and it shows that rosemary essential oil inhalation actually improves the gut health. So rosemary, love it, one of my favorites. Then you've got angelica root essential oil, and one study on rats specifically, not humans, showed that it decreased migraine in rats as a result of its vasoactive. So it was looking at the mechanisms underlying the agitation and the migraine, so to speak, in migraine model in rats. And it was by changing the blood flow and the way the blood flows. So if you've got a tension headache, or maybe linked with hypertension, you have hypertension or any conditions to do with blood flow, then maybe worth considering. But it also shows up in toothache, sore throat, and rheumatism. So lots of benefits there around the body. These are all great adjuvants or add-ons to the program that you're already doing. And there is no one solution. That's what I try to get across to people. Start with the gut and then work out. And there are all these other things you can do to benefit it. Then you've got a little bit of information coming about rosemary, sage, and eucalyptus. There are no good studies on any of them that I can find, but certainly rose oil did improve headaches a little bit. Sage, it's well known, that's why it's called sage, for its benefits in terms of thinking, clarity, memory, focus, and all that. So it probably has a lot of neuroprotective effects. They're all antioxidant, anti-inflammatory. And eucalyptus oil. However, I didn't find any good studies on these. Doesn't mean to say they're not there, I just couldn't find them at the moment. My message is there's a lot of new studies coming out. Essential oils are great to add on for migraines, and check out the videos below to do with migraines and all on gut health, because that will make a difference.